All right, y'all. Welcome again. It is your favorite community health physician, Dr. Ijoma Nadim Opara. We still out here on 313 Day at the health fair here at Dr. Lavon Sheffield Branch Center Library, and it is still going live, y'all. We are still out here really talking about all the many aspects of health. We have tons of vendors. We have so much education going out, so much free stuff. You know, I love that free stuff. I've got my own swag bag, okay? And more importantly, we have amazing people, members of our community here in Detroit, who are doing amazing work, who have wonderful stories, and who have something of value that we can learn from in terms of their life experiences as well as their professional expertise. And so it is my pleasure to introduce to you Miss Tamika Jackson from Mothering Justice, and she's going to introduce us more to herself, where she's from, but then also the work that she's doing with Mothering Justice. And why I'm really excited about Miss Tamika is that not only is she about that healthy lifestyle piece, but she ties it into policy, which we all need to be doing a better job about, and we'll learn more about that in a second. So Ms. Tamika, thank you for taking the time and chatting with us here at Wayne Health Mobile Unit. And go ahead and tell the people more about yourself, where you're from, and how you got into the work in Mothering Justice.
Hi, my name is Tamika Jackson, and I am the Black Maternal Health Organizer with Mothering Justice. I work in political advocacy. I've been doing that work for about 10 years. I started out working on the housing crisis here in Detroit, and kind of moved into more political advocacy and not so much grassroots work. One of the reasons why I started working with Mothering Justice because back in 2022, I had an experience during my birth where my epidural was put too high in my back, in my spine, and so I experienced respiratory failure. But in that process, as I was telling them that something was wrong, no one wanted to listen to me, and it ended up turning into a delay in care for me, and so that ended up turning into a very traumatic experience for me. Luckily, I was able to be revived, and me and my son are both healthy and alive. Yes. But unfortunately, there are too many women who cannot say the same.
That's right. And before you proceed further, I just want to pause first of all and thank you for being vulnerable and sharing that story for us. Too many of us experience what we call obstetric trauma and obstetric violence. And and as you said, the key piece that stood out for me is I said something was wrong and I wasn't believed. And so we have the statistics, right, that Black women are 4 times more likely to experience complications or to die during pregnancy than their white counterparts, or to experience death or to be killed. It all depends on how you frame, right, these narratives during pregnancy than our white counterparts. And you really, and your story unfortunately illustrated part of the reasons why that is that when we speak and say something is wrong, we are not heard and we're not believed. Now we are so thankful that you are here with us, and our baby boy is a baby boy, right? Is here with us. However, as you said, for too many of us, that's not the case. Can you talk more about that?
Well, like you were saying about the numbers, I mean, if we want to be completely honest, we can just say it's structural racism, and for Black women, it's sexism too. We go into rooms and they already don't want to believe us or believe that we have different biological like experiences because we're Black, so we have high tolerance for pain, so you have to deal with that. Then on top of that, as a woman, you have to deal with the sexism of us being dramatic, or you know what I'm saying, we're just making things up. So it's like when you're battling that hysterical in a room, you're hysterical. Like, it takes too much for us to be believed, and a lot of times it takes our lives. So in order for us to really combat that, we do need to see more representation in care, but beyond that, we need to see policy changes.
That's right.
We need to see access change.
Yes.
Right now, access is very limited when it comes to prenatal and postpartum care, especially if you have Medicaid insurance. A lot of people don't even want to deal with Medicaid because they make it so hard, and that process really needs to be streamlined. And as for expansions on the payouts too, we need to see more reimbursements for birth workers. We need to see midwives and doulas in our healthcare system a part of our birthing processes, because it's not enough to just be here when I find out I'm pregnant and give me pills. You know, a lot of times, especially if you have Medicaid, it's just like this revolving door. You're just in and out. You're just in and out. There's no real care there, because how is a doctor supposed to be able to give me the care when the insurance company isn't really paying them to provide me with it? And so what they're doing is trying to bridge that by putting more appointments together so that they can still be able to afford to provide the care, because doctors can go broke. They can provide us with free care if they wanted to, but at the same time, if they're not here to provide us with the care, then nothing will change. But on top of that, we need to have access to birthing centers. I'm excited to be working with Birth Detroit on getting our first birthing center open here in Detroit. And I'm hoping that through these policy changes, we can see improvements in our Black maternal mortality and morbidity, and also education around like postpartum care, mental health services, like all these things that are not being talked about, but also not being amplified because people don't know about these things. It wasn't until I started doing this work that I even knew that there was an issue with insurance and providers. For us as patients, we're just like, I have insurance. We don't think about the process, and for these providers to be able to get reimbursed for the services that they provide us with, and these things are not free for them.
They're not free. And so this is so important what you're saying, Sister Tamika, because again, oftentimes we think that it's just an education problem. Well, they don't know. That's why they don't come for their prenatal or postpartum care, or they don't care, right? There's a narrative, well, folks don't care, that's why they're not showing up. And we lack the knowledge, especially for those of us in the healthcare professional field, to understand that there is a barrier in terms of access to care from a standpoint of coverage, from a standpoint of Medicaid, from a standpoint of insurance on multiple levels. Because you, like our sister said, you can have the insurance, but it's not reimbursing for the care that is being provided by the healthcare provider. There are multiple layers to this. And so what are we saying? That's why we have to go beyond, right? We do our part where we eat well and we eat healthy. We do our movement pieces. We sleep well. We avoid tobacco, smoking, and alcohol and substance use and all of those things. But sometimes you do all of that, but there are external forces in the form of policies that then prevent our ability to live our best lives. And so what our sister is teaching us is that we got to get active, right? We got to organize. We got to come together. We got to get active. We got to name these issues, raise it to the level of the awareness of our representatives, and ask for what will work for us. And health in all policy. And one of those policies, you were teaching me about this, Sister Tamika, is
the
Momnibus Act. Tell us, teach us.
The Momnibus Act is 13 bills compiled that want to address all the issues that are creating our Black maternal mortality and morbidity. So it would be about like creating expansions on provider services, being able to see those reimbursements for our midwives and doulas, seeing funding going into alternative care like birthing centers and breastfeeding centers, breastfeeding consultation centers, different types of clinics, but also transportation care, because it's not even just about getting to the care, it's about the basic needs surrounding it as well. We can't pretend like housing isn't an issue.
That's right.
I know doulas that are working with mothers that are living in shelters right now, and a part of they're trying to focus on their pregnancy and their healthy babies, but they have issues with like, where am I going to take my baby after I leave the hospital?
That's right.
We still have a lot of hospitals that are understaffed due to COVID. There are a lot of nurseries that aren't even open within the hospital, so we need alternative actions while we address our crisis within our healthcare system. So that we can all support one another, because this is about improving our communities, improving our health and our longevity and our families.
That's right.
And we're talking about, these are children. I see so much going on talking about our reproductive health and all of that, but it's like, what are we doing for the babies when they're here?
That we actually have while they're here. Absolutely. And so Sister Tamika, someone will listen to this and be like, get jazzed up, and they want to get up in this and make it happen. So how can they contact you? How can they support Mothering Justice? Or how on their own can they get active, learn more about this work, and get active in making the change on this level?
Well, you can definitely find all of my contact information on motheringjustice.org. You can also visit Birth Detroit or stateofbirthjustice.org as well. That's kind of our movement here in the city around like reproductive and maternal health issues. And we have plenty of events going on all year round. You sign up for one of our events, come out, we can get you connected with policymakers. We don't have $1 million. We're going up against people who are funded by billionaires, but we got 1 billion voices.
Yes.
Okay, collective power is real and it's strong.
Yes.
We cannot do this on our own.
No. I love it. We don't have $1 billion, but we got 1 billion voices, and I will take our voice over any amount of money any day. I want us to end on sort of a self-empowering, self-uplifting note, because folks are listening, and unfortunately your story, my story, myself, even being a physician, unfortunately I do have my obstetric violence, obstetric trauma story as well, where something was happening and I wasn't listened to and had to advocate for myself. And so a lot of us may be watching and saying to ourselves, me too. Me too. How can I, if I find myself in a similar situation, what can I do to better advocate for myself in that moment, or for my sister, for my loved one who may be in that position? What are some of the things that we can do in that moment? Are there any tips that you can offer us?
My only tip that I can think of is definitely asking for a patient advocate off risk.
Yes.
You need someone that is going to hold your caregiver accountable for the care that you're receiving. You need to have that patient advocate. It could come in the form of, you can bring your own. It could be the form of a doula. It could be a midwife. Like, these are things that our insurance providers are paying for now, and it can definitely help. I believe that if I would have had someone in that room with me that was a medical professional, because they asked for my partner to leave the room to provide the procedure, but if I had had a patient advocate there with me, I think things could have also been played out a little bit different. But luckily I did have a nurse who did, one person in that room, and the only person of color unfortunately in that room, she did believe me. And she is the one who instantly got me the care that I needed after I coded, and I believe that she saved my life. But you know, everyone's not that lucky. You know, the people calling the shots might not be listening to you while you're telling them things. People are bleeding to death, having babies.
That's right.
The hemorrhaging it's insane.
Yes.
But do what you can. We can advocate, because we can't say that we haven't been being vocal. If anything, people always telling Black women we're too loud. But definitely find the support. There are resources out there, and I know it's hard when you're pregnant to ask the questions. You can't even think straight.
That's
you know,
right.
you don't know what
That's
to ask for.
Yeah.
But patient advocacy, having someone in that space with you to help you, and having that guide throughout your pregnancy too. If you can have a doula or a midwife or some type of clinical support. I know that some of these insurance companies are expanding on the support for mothers, and these are ways that we are taking steps towards improving maternal mortality. But definitely take advantage of every resource that is out there. Please reach out to us. I'm building up resources to be able to connect mothers with. And hopefully we will see a change in the next few years when they finally do their research, and I want to see a decline, but I definitely want to see support. So check your state, see which one of those mom-to-biz bills is active in your state, and support that. Support whoever is sponsoring those bills. Making sure those folks are getting reelected, because if they're sponsoring them and they're not elected, those bills will disappear.
That's right.
Remember, we don't get to vote on the policies, but we get to vote for the people who will vote on those policies.
On the policies, and that's on period. So you heard that. You know, ask for that patient advocate. Bring somebody with you. But healthcare systems also have those patient care advocates. Okay. All right. Thank you, sis. It was great. You have to run. We have to run. We will make you late.